Hello, everyone. My name is Yisung Lee. I am a ASHA and state certified speech language pathologist at Casa Colina Hospital. I am also certified in Lee Silverman voice treatment, and I am one of the speech pathologists that run the Parkinson's disease support program here at Casa Colina. I'm here to talk about Parkinson's disease in honor of Parkinson's Awareness Month. So in this video, I will be briefly going over Parkinson's disease and what my job entails as a speech language pathologist when working with patients with Parkinson's disease. So I hope you find this video helpful and informative for you or your loved ones who are going through this disease. So let's talk about the cause of Parkinson's disease. So far as what we know, Parkinson's disease is caused by a lack of dopamine in the substantia nigra of the basal ganglia. So the substantia nigra is an area of the brain that's responsible for producing this neurotransmitter called dopamine. The basal ganglia is responsible for the coordination of movement. So when there are not enough dopamine, there's not enough information being sent out effectively to communicate with different parts of the body. So just to kind of briefly go over some of the symptoms of Parkinson's disease, some of the things that you might be very familiar with are that patients with Parkinson's disease demonstrate slow movements or reduced motor activity. You may notice a lot of postural instability with some of these patients, a lot of resting tremor, a lot of rigidity in their body, and a very masked face, so very flat affected. So the expression of emotions may not be as explicit compared to how they were prior. Now, going over some of the other symptoms you may see, my scope of practice as a pathologist involves the swallowing, language and cognition, and speech and voice. So you may notice that you or your loved one going through with this disease may have difficulty swallowing. So I'm talking coughing with meals. They may have an increasing effort to swallow. It may be difficult to swallow, and then they may have choking episodes. Sometimes with this population, you may see some recurrent aspiration pneumonias. And that's due to any particulates like drinks, salivas, food going below the level of their vocal folds and penetrating deeper into their lungs. That results in a pneumonia. Now, as 35 to 55% of patients with Parkinson's disease have dementia, with the dementia, you will notice changes in memory, attention, and executive functioning. And executive functioning could be anything like high-level skills that involve problem solving, organization, and planning to be able to go about doing their activities of daily living. And just to briefly go over the language portion that might be affected is you may notice with this population that they may have difficulty finding words. Now, lastly, you may definitely notice some changes in this population's speech or voice. And typically a lot of what my Parkinson's disease patients talk about are changes in their pitch or loudness. So they may feel like their range of their voice is very limited, so they may become more monotoned. They're not able to be as loud, so they sound very quiet, and a lot of them complain about their family members not being able to hear them. In addition to that, you may also notice a breathy vocal quality, a lot of tremor in their voice, some slurring in their speech. That also results in maybe, a lot of misarticulation, articulation errors, and then also short rushes of speech that's really hard for them to control. So all of these things kind of play into their role of their cognitive communication skills. So now when it comes to the management of speech, language, cognition, and swallow in this population, one of the things that you will probably hear very often is something called Lee Silverman voice treatment. Now, Lee Silverman voice treatment, it's used to improve loudness and intelligibility for people with Parkinson's disease, and it does so by improving the vocal loudness through increasing vocal effort and improving the medial compression of their vocal folds and improving the overall self-awareness of their voice. So it's kind of like you're recalibrating their system. So in doing so, a lot of what we work on is working on just having high effort, being as loud as possible, but then also changing some breathing habits as well. Now, the thing is with Lee Silverman voice treatment, it cannot be called LSVT unless it follows a specific protocol of 1 hour sessions 4 times a week for 4 weeks. Now, we do not provide LSVT treatment here. However, what we do is we do follow similar principles of high intensity and good breathing and respiration breathing and voicing coordination. In addition to LSVT, something that you may have heard is something called Speak Out. Now, I'm not certified in Speak Out. However, it is still very similar in the concept of being loud, and though it does work on some exertion or putting more effort into voicing, it is not as intensive as Lee Silverman voice treatment from what I know. So next, I wanted to talk about something called expiratory muscle strength training. Now that goes by EMST. So what you see on the screen, there are actually 2 different types of EMST, and I actually have one right here. There is the EMST 150, and then there is the EMST 75. The 75 being the easier version and half the intensity of the 150. So the whole point of EMST, it improves cough strength, it strengthens swallow muscles, and it improves respiratory drive. Now, what does this all mean? So when I talked about how swallowing can change, swallow can change with the progressive nature of Parkinson's disease because as it also affects your voice, there could be a lot of atrophy, a lot of weakness. It's going to also affect the swallowing muscles involved. So one of the ways that we want to try to maintain swallow safety is by having adequate cough strength. And that is something that is really diminished in this population because now their breath support is not that great. So their ability to forcefully force air out of their airway is very diminished. So then as a result, things that should normally be coughed out end up staying in the airway. So the EMST is a one-way threshold device that allows the air to go in from here that you blow and it goes out this way. Okay, so it is a threshold device because what you see here is there are different levels. And so as you exert, as you tighten up, you will have to press or force much harder. And it's to try to mimic the overall process of a cough. All right, so now in doing so, one of the great byproducts of this device is that it also improves your swallowing muscles. Okay, so it's a great way to address that cough strength, improve your overall swallow musculature, and then working through all of this, hopefully that you will have a better respiratory strength to be able to have a stronger voice, to be able to have better endurance for longer periods of talking. And overall, it's a great tool that I like to implement for some of my patients with Parkinson's disease in addition to their home exercise program. Now this is something that does have some contraindications, so please talk to your primary care physician or a speech language pathologist to see if this is right for you. In the PowerPoint, you'll see that I have posted a link. If you're interested in finding what these contraindications are, feel free to type in that link ahead. So now, what does swallowing management look like for patients with Parkinson's disease? One of the things we recommend is, let's say you are noticing you or your loved one having frequent coughing, choking episodes, or just overall showing an increased effort to swallow, and maybe that's resulting in them not eating as much as they used to. I highly encourage you to meet with a speech language pathologist for a swallow evaluation, and then from then on, there can be some few things that we can do for you. Some of them may recommend something called a modified barium swallow study. That's basically like a swallow x-ray, and it allows us to see internally what exactly is going on with the muscles, because there are many things we can definitely speculate, but we're humans and we don't have x-ray vision. So a modified barium swallow study would be a very in-depth view of what your swallow mechanism looks like at this moment of the disease. In addition to that, let's say you do complete the modified barium swallow study. Some of the things that an SLP may recommend are things like diet modifications. That could involve making solids to be softer. Maybe it has to be prepped a certain way. In addition to that, liquids can also be thickened. Now, thickened liquids are not a cure-all. Thickening liquids will not suddenly make swallowing safer. In fact, it can also make it more risky or even more dangerous. So please do not thicken everything thinking that it's going to fix everything. Talk to your SLP and see if maybe they can prescribe what is right for you or your loved one. In addition to that, after the MBS or the modified barium swallow study, they may prescribe some swallow exercises to try to strengthen the swallow muscles and then maintain that function for as long as possible. They may also even recommend certain exercises to try to keep your swallowing safe during your meals or anytime you are having any kind of intake. So as I mentioned earlier, 35 to 55% of patients with Parkinson's disease having dementia, cognitive maintenance is going to be very important. That involves being mentally active. So, taking part in your day-to-day, making sure you have routine. In addition to that, I highly encourage people with Parkinson's disease to participate in support groups or social groups. And there are plenty, I'm sure there are some in your area, and some hospitals do host them. In addition to that, I would also consider cognitive therapy, especially if you're in the early stages of Parkinson's disease and you may notice some cognitive changes. Cognitive therapy with a speech-language pathologist, such as myself, we can work on strategies and ways to try to compensate or forming new habits and routines to try to really work around some of the deficits that you might be experiencing. Now, in addition to that, lastly, you want to maintain an adequate nutrition and maintain your medications, because how can you have good cognitive maintenance when your body is not getting the nutrition and medication it needs? So I highly implore you to be very thorough with your nutrition and medication as you go through with this disease. So here at Casa Colina, one of the great things we have is a Parkinson's support group with some of the members who have been here for quite a few years. And so a great thing about our group is that it allows socialization with other members diagnosed with Parkinson's disease. And it's a great program that we have that is run by our physical, occupational, and speech therapy, me. And so the great thing about this group is that it allows our members to be engaged and active in their maintenance with living with the disease. So it's a great place to receive education and support. And usually we alternate between physical and occupational and speech therapy. So I hope you enjoy. Thank you.